and wishing you a very happy 2026. Welcome to the second episode of Let's Heal Cancer, and I'm Dr. Rachna Chhachhi, integrative cancer expert. Cancer, cachexia, a serious condition impacting a significant percentage of cancer patients, particularly in advanced stages of the disease. It's primarily defined by a substantial and ongoing loss of skeletal muscle mass, which may or may not be accompanied by fat loss. This muscle wasting cannot be reversed by standard nutritional support alone. But here we have with us Dr. Bharat Bhosale. Welcome, Dr. Bharat, and wishing you a very happy new year.
Thank you, and Happy New Year to you, your family, and everyone who is listening.
Thank
Hopefully,
you.
this year we will focus on health, not when we become patient, but before becoming a patient, one should know look after their health.
Yes, Doc. So for everyone who's not seen the first episode, Dr. Bharat and I do episodes of Let's Heal Cancer together so that we can reduce the burden of cancer and create the clinically, scientifically proven information and facts about cancer prevention and cancer healing. Dr. Bharat is associated with several major hospitals like SL Raheja, Bombay Hospital, Medical Research Center, Mumbai, Holy Family Hospital, and he is the founder director of BB Precision Onco-Care Center. Dr. Bharat,
Thank you.
very serious topic, cachexia. What is your view and advice?
So, see, as a clinician, when we used to refer to this term of cachexia, we also know as a physician, we all like this is a condition where something is related to a weight loss. But now I know when I started practicing in oncology, obviously chemotherapy is an integral part of cancer care. And then we started labeling a patient cachexia related to weight loss. But now scientifically, I'm a part of cachexia group worldwide. No, we discuss these problems. Uh, so cancer cachexia is not only weight loss. It's not something which is related to only weight loss, but losing the strength. And the interesting part, it may not be always associated with a loss of appetite, not eating properly. So cancer as a disease affects the body, and it's a process of inflammation. Biologically, if you look at the markers, there are something called as cytokines which are released in the process, and that leads to disorchestration of the body. So in a lay language, I can say there is orchestration. When we get a good music out of the body is in good function, gets up early in the morning, eats properly on time, sleeps adequately. So these are the natural processes designed by the environment. That's why there is a day, there is a night. So if you take a
So the
long
supposed
flight from US to India, you have disturbances in your sleep, right? So that is how a body is always in a perfect equilibrium. And when the cancer happens, the body sets up into process of inflammation, and that inflammation leads to imbalance, which ultimately leads to loss of muscle mass, loss of proteins, and loss of energy, loss of strength. What it leads to a sense of not being, feeling good. We label it as a well-being. So there is no well-being. So ultimately,
right.
what happens? So everybody, everything we do for our well-being. So we should look good. We should walk an adequate distance. We should climb flights. So in a patient, the weight loss, which traditionally we used to say 10%, but it's not 10%. It's something which is less than that, 2.5%. You should
Hmm.
identify these patients who are cachexia, where they are
Hmm.
losing muscles, they are losing weight. And ultimately, it
Hmm.
leads to no feeling of tiredness, feeling of fatigue. And when
Hmm.
it comes to a cancer patients, these are the
Hmm.
patients which you need to identify. Otherwise, what happens? The tolerance to the treatment is bad.
Hmm.
They cannot tolerate the treatment well. There are
Hmm.
treatment gaps happening because of that. You are not
Hmm.
able to deliver the treatment to the fullest extent. Sometimes this
Hmm.
happens in the curative settings also, not necessarily. Previously, this terminology we used to label for a palliative patient who is on no terminal stage, not
Hmm.
able to sustain the treatment. But
Hmm.
now in a curative setting also, sometimes the cachexia sets in, where you are not able to deliver the treatment properly. which
Hmm.
leading treatment delays, sometimes not able to take the treatment properly, and ultimately what happens? Then it affects the survival.
Yes, very
Treatment
true.
fails.
Yes.
So this is the Cachexia. Now there is a component which sometimes there is a mental component, a component of mental health,
Hmm.
because a person comes to know that you have a cancer, then a
Hmm.
process sets in,
Hmm.
which we call a positive thinking, negative thinking. It's for a general discussion, but then to
Hmm.
some extent, diagnosis of breaking bad news also affects the mental uh, process very
Hmm.
badly.
Hmm.
So how we talk to the patient is very, very important. Not only know what we eat, how you communicate, how you induce that process that this is treatable. Sometimes the cancer is completely curable, but
Hmm.
patient may take up that news as a bad news, and a
Hmm.
downhill process starts. So that affects the anxiety,
Hmm.
depression, which affects the food intake ultimately. That also counts. Sometimes some diseases are in the mouth, in the gut. So they induce a process called as nausea, vomiting. To some
Yeah.
extent, that also affects your food intake.
Hmm.
Sometimes these tumors in the stomach can create a structural obstruction. Then your food intake goes on. So it's not only one process. It's many processes based on what cancer the
Hmm.
patient is suffering from. And that is how dealing these problems right at the diagnosis is very, very important.
Hmm.
Because in cachexia, there are stages. There are no early stage where you may not see a significant weight loss. Then
Hmm.
the patient goes into that defined weight loss definition
Hmm.
where the patient is cachexia. The
Hmm.
most deadly thing is refractory cachexia. Once the process sets in, you can't revert it. Dietary interventions are the most important thing over here. Patient is
Hmm.
not able to eat, but he has to eat, right?
Very true.
So you have to address the anxiety, you have to address the depression, you have to address the nausea, you have to address the vomiting issues, and then you have to make sure that patient should get the adequate amount of calories. At the same time, the protein intake should be good. So
Very
all
true.
these things, even if we look at, we label it as a holistic approach or integrated. So this is what the integrated medicine is. You are giving a chemotherapy target. Nowadays, we do immunotherapy, you go targeted therapies. Their side effect profile is different. Chemotherapy
Hmm.
itself induces nausea, vomiting, lot of nausea, vomiting. You need chemotherapy, but chemotherapy is associated with side effect. But
True.
you can't get cure without chemotherapy.
True.
So
I
you
agree.
need to counsel patient that this is a tough road. We'll take it, this part together. Our job is to make it simpler for you. If
Hmm.
you don't take it just by listening to others that it is harmful, it kills, and this is where no myth about chemotherapy.
Hmm.
And that's why you need an oncologist to give chemotherapy. You can not take a chemotherapy with someone who is not expert in know how to give chemotherapy. And that is why I always believe it's a teamwork. A
Hmm.
psycho-oncologist, a dietitian, oncodietitian, a surgeon, physician, a radiation oncologist, physiotherapist,
Hmm.
which will help the patient to get down the side effects, reduce the side effects, so that
Hmm.
patient finishes this tougher path, see a good scan, which is a clear scan, and then maintaining that remission is the job the patient's body has to do it. Our job is to tell them how to do it. Ultimately, it is the battle which is going inside the body, right? And many patients nowadays we see they are even stage 4, they are living more than 10 years. Breast cancer, oral cancer, and just by believing in their own body, because it's the body's immunity which controls the cancer. So ये कहीं हम बाहर से नहीं, except the immunotherapy which is newly coming up, they are taking out the immune cells, engineering them with chimeras and sending them back. So ultimately, it is their immunity, it is their body's T cells, and
Hmm.
diet, exercise helps to boost those immune cells.
Right.
So usage of right medications, right counseling, with
Hmm.
psychological counseling, which we specifically address as a psycho-oncology.
Hmm.
So these things are very, very important.
Hmm.
Not only supplementary, I think equally important.
Equally. Yeah. In
Equally
Cachexia,
important. It is
yes,
very, very important.
because how will the patient get the energy to not miss the chemotherapy sessions, to be able to get the hope? Hope comes from energy. So,
Yes, yes, absolutely. See, it's not only cancer, it's all the diseases. See, the biggest problem now is obesity. People
yes.
are now getting the drugs and they're very happy. They are taking the drugs. but that drug is causing severe muscle loss. Yesterday I was reading news that patients are getting anxiety and depression. People are no. There was a news. I have not authenticated, but there was some news related to the weight loss drugs. People are becoming depressed. People are becoming anxiety because in the process of losing weight, they lose the muscle mass.
Yes.
I'll come to the axis called as a brain, gut, skeletal muscle, and liver axis. So that losing muscle is very critical because muscles are the things which from the tendons send the sensation to spinal cord to the brain, and this activates your brain. So whenever we are doing exercise, it's not just to look good. Those people who lose weight, they feel good. They are more energetic. They finish their task easily. Right? The same thing applied in a patient. It's not about only taking a right diet. It's about doing a right exercise. A right exercise means based on your age, how your bones are. The muscles needs work. It requires a stimulus. It stimulates the gut as well as your liver metabolism as well as your brain. It addresses the anxiety. It addresses the changes in the gut. Now coming to the liver and gut, lot of microbiota is there inside. No? There are microbiomes in the gut. But a right microbiota, you can throw a light on this, is important for immunity. So nowadays, scientifically, it is proven those people who have a right microbiota, which is called as a good bugs in the gut, stimulates the body's immunity in a right way, which actually helps to fight the cancer cells. So whenever I finish the chemotherapy, I leave the patient with a good scan. Now it is the body's ability to maintain the cancer cells suppressed so that your scans remain in a remission stage. So there it plays an important.
It's interesting you brought this up because I'm trained in cancer metastasis, and I get a lot of patients with the cachexia in metastasis. So they've already been through, one round, and then a few months later it has come back, and they've lost a reasonable amount of their skeletal muscle mass and body mass, and demotivated also with the diagnosis that why has it come back again. So a combination of the mental health therapy along with very, very strong nutritional support, which will not increase the cancer cells in the body to cause further metastasis. So, there is a myth around saying that have any kind of protein. Yes, protein is very important. We should have for reversal of cachexia, there's actually a combination of good fat and vegetarian protein. And when I say vegetarian, I'm not talking about the animal-based vegetarian proteins, which start reducing the cachexia, increasing energy, and that amazing point that you brought about, creating a gut microbiome environment for the patient to fight the cancer cells.
There is a deficiency in the immune, there is a defect in the guarding, the cancer will happen. So I think now we have enough scientific evidence where we know that better immunity means prevention of cancer, or if cancer is treated, prevention of recurrence. So we have to work on all these aspects, like exercising, getting good diet, and in a good diet, patient needs hand holding. Forget about people. Now people are, when they don't have any disease, they are going to dietitians. It's better to develop this right from the childhood.
Yes, but in cancer, but in cancer, when there is diagnosis and there is the adjuvant therapies of nutritional counseling and exercise therapy, then the outcomes of the patient increase. They don't miss their treatment with the
Absolutely, that's
oncologist. And a role that, doc, I have seen, which most people don't understand, is the role of good fat in releasing cachexia and increasing the gut microbiome, good bacteria. So our indigenous, flaxseed oil, what we call locally alsi ka tel,
yes.
extremely good for cachexia. Then, of course, the extra virgin olive oil, which has been scientifically proven for this, and other nutritional support for vegetarian protein, carbohydrates like quinoa, like millets, and the certain kinds of dal, because the gut is not able to digest the tougher
No,
pulses like
absolutely.
this.
Yeah. So dal is a good protein.
Yes,
Green leafy vegetables, as you mentioned, some seed oils.
yes, seed
So
oil.
it's not about only generating protein and muscles, but at the same time, you have to provide adequate calories. The patient should get amount of no calories also,
Right, right.
and it should be in right balance.
Yes,
And as per the stages, you have to know modulate that. You have to make changes in it.
yes.
That is very, very important, and it reduces the overall chronic inflammation.
Mm,
Right? You treat with surgery, you treat with chemotherapy. Then nowadays we have liquid biopsies available, which can actually check that there are circulating tumor cells. There are
mm,
ctDNAs. Those patients who do not show these things, they do well. But
mm,
again, beyond the capacity of modern medicine laboratories, there are
mm,
still cancer cells which we cannot pick up, and sometimes when the immunity goes down, it's it's
mm,
it's not that cancer cells are only small. It is your immunity which is keeping them under control. When that immunity goes
mm,
down,
mm,
then these cells again starts proliferating.
mm,
Again, the same process starts, no, and that causes metastasis or
mm,
recurrence or say new cancer.
mm,
The moment your immunity goes down and the cancer cells or proto-oncogenes become stronger,
mm.
they cause cancer or cancer
Yes.
metastasis or recurrence. Immunotherapy is based on that principle only.
Mm,
The immune checkpoints, which are actually tumors or tumor cells, they
mm,
use these checkpoints to keep the immunity suppressed. The
mm.
body has an innate capacity, a natural capacity to mount an immune response like any bacteria. Like,
Right.
see, we in India, tuberculosis is very common. You inhale tuberculosis bacteria, I inhale. But those people, their immunity is strong, the tuberculosis will not happen.
Very true.
TB happens to those who actually know are deficient in the immunity.
That's true.
Right. It's a cancer is somehow, it's not exactly same, but the same process applies over here.
Who's today only I was talking to him. One of the things that has really helped him is that initially, because there is so much fatigue related to the cancer and the treatments, only the nutrition doesn't work and there is no motivation for exercise. So we put
So,
him on a massage schedule with a certified massage, because it's a very gray area and
yeah,
some
yeah, I
people
agree.
can injure themselves because of too much massage. So gentle physiotherapy based massage, it helped increase the motivation and release some of the pain. And then we moved him to gentle exercise, and then gentle exercise where the
So,
muscles became strong, then he could walk.
so what you want is stimulating the muscle. Massage is also
Yes.
stimulating the muscles. When the person is not able to walk, so I
Right,
tell them use the rubber band, at least stimulate the upper end. So if you have problem with the legs, you do passive
right,
exercise. So these are all
right,
the kinds of passive exercises,
right, right, right,
right?
right. Yeah,
So some kind of stimulus is very, very important because everything is related to know every receptor is stimulating your brain. What is
yeah,
the tumor? What the treatment is going on? What are the side effects? The dietitian also should know all these things in a
yes,
brief. I'm not asking them to read everything, but
yes,
every dietitian must know what is the stage of the tumor, what treatment is going on, what proportion of nausea is contributed because of the drugs, what
yes.
kind of a mucositis patient is suffering. Then you can give a proportion of a diet which will be easily
Digested.
eatable. No patient
Yes,
can taste it
yes,
because
yes.
we don't just eat to fill the tummy. It starts
Correct.
from here. We see the food, we
Yes,
smell the food,
yes.
and then
And the taste gets spoiled so many times. So, there will be mouth sores and mouth ulcers, and the taste gets spoiled. So, they are not able to eat or enjoy the
no,
food.
I'm telling you, there are patients who love food, and then with chemotherapy, they are depressed because they don't know. Sometimes people know it. Don't eat this, don't eat that, don't eat sugar. No, see,
Mm,
everything in proportion is good. Now,
mm, mm.
totally cutting down and everything, no. So if you can't, because they love to eat that particular thing, they see it, they know that no, I like this, smells
Mm,
good, and then you are not eating it. So it is adding to some extent. So that is where the dietitian handholding is very, very important.
yeah,
And
it's very
nowadays I
unfortunate.
see people
Yeah.
look the background, the ethnic background of the patient, and then they give set
Oh,
of
yes.
diet to the
We
patient.
have
That
a
is very
bank
important.
of, yeah, we have a bank of about 500 plus recipes for patients, as per their ethnicity, as per their taste and flavor. So, and I openly say that tell me what you want to eat. Let me create something for you where you will enjoy it, and I know that I'm not giving you a carcinogen. So it's
No,
a
see, this is very important. Now people are going to come to you. Now, this is a good dietitian. She wants to feed us what we want to eat. So
no, I'm not a dietitian,
no, no,
so
I said not a dietitian counseling. No, so you'll provide.
nutrition counseling definitely.
It's a integrated thing. No? So it actually
Yes,
helps to improve the strength, fatigue.
yes,
Fatigue is the biggest problem in cancer. Every patient, and then
yes,
you try to integrate the food, exercise, and once they get out of that fatigue, they are ready, to take whatever strong chemotherapy we prescribe, and it ultimately improves the quality of life. It gives the dignity, self-confidence to the patients. So we
right.
never talk about.
Yes, because if there is self-confidence, then there is motivation to beat it.
Yes, yes.
Yeah, yeah. So the role of good quality high calories, so which is why I talked about good fat and proteins, spares the muscles, in the energy burning, because there is hypermetabolism that happens in cachexia.
Yeah, so it's about heightened catabolism, suppressed anabolism. That is Cachexia.
Yes, doc.
And
Yes.
here I feel food is not a fuel, but it's a treatment. It gives you comfort,
Yes.
it gives you strength to fight the cancer, get out of it, improve your
Yes.
quality of life, and live a dignified life.
Very true, very true, very true. Yes. So that is what, to everyone who joined in late, we are doing the second episode of Let's Heal Cancer with Dr. Bharat Bhosale, precision oncologist, and I am Dr. Rachna Chhachhi, and I'm an integrative cancer expert. And we are talking about the combination of the oncological treatments combined with nutrition and exercise to increase outcomes, make you reach a stage of homeostasis, which Dr. Bharat had talked about earlier in this podcast.
Once we see a patient, we prescribe treatment. But beyond that, I always believe that this is exercise as a pill. And
Yes.
I remember the day I started practicing, I always write. So I don't write pill, but now I started writing exercise pill and nutrition.
Very
So that is
nice.
your part. No, you have a team which can know taken care. And beyond certain things, we also don't have time to pay attention, but we make sure that our job is to guide the patient, go to a right person who can guide you for the diet, who can guide you for the exercise. And this is what I think, integrated approach. It's not only cancer, but many other fields now need geriatric population is going to increase in India, which is actually increasing. And cancer is a disease of old age. So we
True.
have a geriatric problem as well as cancer. Diet is, should be planned from day one
Yes,
for
from the
patients.
diagnosis time. That's how we see better survival outcomes as well as reduced recurrence chances.
Yes, yes, absolutely. Maybe we can take up one by one these topics in the future podcast. We can focus on one particular area. We can, because exercise means everybody feels that going to gym, getting big
No,
dumbbell is
no,
not
no.
like that. You
No.
just have to give a
Yes.
resistance to your muscles, which are in capacity which doesn't harm the muscles.
Yes, yes. And it starts from very small things, Doc. I was talking to someone and I was telling them that you need to exercise the tips of your fingers by writing, by playing an instrument. Why? Because this is connected to the brain
Yes,
and
absolutely.
it starts stimulating your appetite. So
Yes, yes.
hence you will eat better and reduce your cachexia and increase survival.
No, it's not only diet, it's the water also. You need to have a good quality water in adequate amount. So,
There you go.
yes. No, good, good.
Very true. Very true. We are
So,
70% water, so it's
yeah. So drinking adequate amount of water is very important, because these patients have nausea, vomiting, they throw a lot of water out of body, and if you don't replace, that also adds to your not eating well and then losing weight and ultimately cachexia.
no,
So
that's
everything is connected. Everything is connected.
yeah.
Unfortunately, we don't pay attention when while our the period of our maximum growth happens in 10 to 10, 20 years of age, where if you get a right mentor or
Right,
guidance, I think
right.
half of the diseases, chronic diseases, can be prevented totally.
No, that's true. That's true. There is so much suffering if we look at the data for non-communicable diseases that are rising because of lifestyle and environmental
Yes.
factors. That's what our foundation does. It focuses on sustainable nutrition, sustainable living to reduce the burden of these diseases. And doctors like you are so precious in raising this awareness. So really grateful to you for
No, no,
this.
this is very important. Everybody has to understand this. This is something going to be a big problem in the future.
Hmm.
Chronic diseases, as including cancer,
Hmm.
and we are not prepared in terms of the resources to tackle it.
Yeah.
So the best thing is to prevent the problem. So
Hmm.
for cancer patients, it's better to prevent the cachexia, because once cachexia sets in, it's very difficult to treat it.
Hmm. Hmm. It is, yes.
So
Yes.
I think from day one only, you should have counseling related to the nutrition, related to the exercise, and then it should be periodically that patient needs to be reassessed, and it
Hmm.
should be readjusted according to the strength and appetite of the patient. That's why I mentioned it's a pill. It's an exercise pill. It's a nutrition pill.
And when a senior oncologist like you prescribes this as a pill, that nutrition, exercise is as important as getting the therapies done to scientifically heal
Yes.
yourself. That's where they believe.
See, we write the chemotherapy, targeted therapy, or immunotherapy based on the evidence which comes out of the clinical trial.
Of course.
So, exercise has been proven in the phase 3 trial, which is the highest level of evidence,
Yes.
which actually, after colon cancer treatment is over, half set of patients are given a planned exercise, and half of the patients are counseled only. And there is a 8% or 10% improvement. The relative reduction is more than 30%. You are reducing the risk of death by just doing a planned exercise.
True. Very
And up
true.
to 8 years, there are significant number of patients develop less recurrences and less number of deaths in that arm. So it's a drug for me,
True.
because and it's a free drug. Sometimes people don't understand the importance of a free things. Then comes the role of counseling. So that is why a planned exercise, where you just planned. Why? Because you have to avoid the fall and fractures, because these are the vulnerable populations.
Yes.
That I'm not the person who can guide to do what is the right exercise, what is the right diet. So there are people who works like with
Mm.
you. You
Yes.
have expert dietitians, you have expert physiotherapists. You can allot for the age group, for the kind of a cancer person has, or the stage or strength
Yeah.
of that patient. That is very, very important.
That's true. That is true. And we cannot just say go for a walk because, like you rightly said, they can fall and they can have a fracture. So we first build the balance with muscle.
Yes.
Some patients who come to me couldn't even walk, so I gave them on bed exercises. Lie down on your back and do these
Yeah.
exercises. So it starts slowly like that.
Yes. Yes. It's very important, and I tell all my colleagues also, because what we practice is half medicine. It completes with nutrition and exercise only, and a mental exercise. Giving
Yes.
positive thoughts, have a conversation, listening to music which they like. Today I finished first cycle of my patient, and she's from Marwadi background, and I said, what music you like? Same like Bhagwan ke. मतलब कौन से particularly? So the मतलब बनाओ. ये. And she said first thing, thank you so much for giving me. I had a fantastic session. So this is about tolerance of the treatment. I
Mm.
personally believe it improves the survival also. So I
It
am
does.
behind to prove it. Nobody has
There is
proven it.
research.
But
There is
ultimate,
research to prove. There
yes,
is
yes, their appetite improves, their anxiety goes down, they come out of their depression, they eat well. And ultimately, it boosts their confidence.
Yes, very true. There was a study done where the mind-body interventions for breast cancer patients was done with metastasis, and in a 6 week span, this research is also in my book on cancer. In a 6 week span, they tested the telomeres on the
Yeah.
DNA, and the telomeres lengthened. So it's a learning for all of us to say something that you and I talk about every day, and you practice this not only in your center but with your patients.
Because I believe in this. It's not only my treatment, but patient has to believe in themselves. So it's
Yes,
like, as I mentioned, dignity of the patient. It comes when they feel good.
true, true.
See,
Yeah.
that's why telling someone that you have cancer is a big responsibility.
Mm.
You have to make sure that this patient prepares himself or herself to get cure, but at the same time, there is a chance that this news only can break him or break her.
Very true.
So oncology job is not easy. You have to give them a treatment which creates so many complications, and still they have to come back to you after a week or 3 weeks. So that trust has to be transparent. Tell them all the ways which they can utilize to fight this cancer, because the ultimate goal is to make you better and get a cure to you. Then whatever best possible way, I must practice. I must know all those ways. Because simply giving chemotherapy, I believe, yes, it kills the tumor cells. But once I finish the chemotherapy, then the patient has to fight with the cancer himself or herself. Then what? So it is
then
all
that
diet,
strength comes
exercise, and the self-belief is very, very important. Just telling the patient be positive is not enough. You have to teach them how to be positive. You have to teach them how to get to that positivity. That is very important. And it's a process. It's not 15 minutes of conversation. It should be a repetitive process.
Very beautiful the way you're so committed to helping with the holistic outcome for cancer patients. And uh, we are at the end of the episode, and we have talked about the role of cachexia in recovery. And Dr. Bharat has shed light on how we have to catch cachexia early so that it can be reversed and the patient can get the motivation, energy, muscle mass to show up for the treatments which are as important and complete their chemotherapy cycles and treatments, as well as have the strength to reduce chances of recurrence through a good immune system. If you found this episode of Let's Heal Cancer with Dr. Bharat Bhosale, precision oncologist, and me, Dr. Rachna Chhachhi, integrative nutrition cancer expert, please like, share, comment to help people with cancer, with prevention as well as cure, as Dr. Bharat says.
So cure is possible. You have to believe in yourself. And if you want to know how, please do share, like, and comment. Thank you.